Yuma's only hospital, Yuma Regional Medical Center, has seen a significant number of migrants seeking medical care. Now, all of this since the start of the border crisis, causing the hospital to lose millions of dollars. News 11's Samantha Bird spoke exclusively with the hospital's president and CEO to learn how this is affecting YRMC and if there's a solution in sight.
Since December of 2021, Yuma Regional Medical Center has provided $20 million in uncompensated migrant care.
And you've seen some of the more sensationalistic headlines. We're not on the brink of collapse. We're very strong from a financial perspective, operational perspective, and clinical perspective.
Dr. Robert Trenchel, president and CEO of Yuma Regional Medical Center, says the message he wants to get across is having to care for migrants without compensation is an unsustainable model to continue running on.
We can't send them a bill because we don't know where they are. Normally we would do that. We would send them a bill and work out a payment plan for them, whatever they could afford. But since we don't have an address for them, we don't know where they're going, we don't know how they're getting there.
Dr. Trenchel says the migrants come in with a variety of health issues.
It's everything from bumps and bruises, coughs and colds, to kidney dialysis, cardiac catheterizations, and heart surgery.
There are also many pregnant migrants who cross the border and deliver their baby at the hospital.
Many of them have had no or limited prenatal care, and that's an issue for both mom and baby. And many of those babies that are born wind up in our neonatal intensive care unit, sometimes for over a month at a time.
From December 2021 to April 2022, there were 56 maternity patients, costing the hospital an estimated $1.4 million. Dr. Trenchel says if the migrants are in Border Patrol custody, they are able to bill them, but often that is not the case.
I would say 99% of the time, maybe 99.9% of the time, Border Patrol brings them in, leaves them with us, and then they release them from custody at that point.
YRMC says neither the city, the state, or the federal government is providing funds to accommodate the costs associated with the migrant influx.
We've really explored every avenue, and many people are sympathetic and lend a listening ear, but nobody really has a solution for us.
The hospital says it will continue working with state and federal leaders until they find a solution to the uncompensated migrant care. Reporting in Yuma, Samantha Bird, News 11.